over here at the Warren County Chamber of Commerce. We do these lunch and learn style webinars and in person usually every month. So you can always find us on our website, warrencountyga.com, under the Chamber tab. And today we're going to be talking about insurance with Miss Teeyana, and she's going to just tell us about different programs and stuff that we can partake in as small business owners. So I'm going to give it over to you.
Thank you very much, Danielle. I really appreciate being here. Like she said, my name is Teeyana Wullenschneider, and I work with a company called Sparta Biz. Sparta Biz started during the pandemic because we watched a lot of small businesses having a lot of trouble with their employees, having difficulty with retention, dealing with COVID side effects, and just basically struggling to meet the requirements a lot of counties and states were putting onto small businesses to support their employees. So we put together and worked with some other companies, and we put together a couple of plans to help a variety of businesses of different sizes. And we like to call this the wellness program. It is not actually a wellness program, but we say wellness because it is all encompassing for a variety of different things, but it's multiple different elements that you can pick and choose from, but we just put them under one hat there. So there we go. So the idea behind this program is that this supports a business and their employees both with their wealth, with deciding retirement, with deciding what they're doing for insurance, whether that's life insurance, as well as their health. These are things like, when do I go to the doctor? How do I deal with incidents that take place on site? Do prompt care, prescriptions, all of those things that are involved with just keeping your workforce healthy. Idea behind this plan is to cover both sides of these challenges that business owners face. And there are a lot of challenges that are out there. So the idea is that you have multiple different levels of employees. You have your full-timers. These full-timers, for our purposes, is anyone who's making more than $18,000 a year. And that can include what's traditionally considered part-timers. Then we have what we are classifying as part-timers, and that's people who make less than $18,000 a year. And then you have your contract workers or your 1099ers. For the most businesses out there, this is going to cover your whole workforce. And we have different solutions for each level of your employees. Some of these are going to be more benefit heavy than others, and it's what works best for your business and your employees. So let's talk about full-timers. Now, like I said, full-timers are individuals who make more than $18,000 a year. The solution we have for this is what we call a cafeteria plan. A cafeteria plan allows you to have what's called minimum essential coverage. This includes doctor visits, prescriptions, urgent care visits, but it does not include ER visits or if you come down with cancer and you have to be admitted to the hospital. It doesn't include the big things, only the little things. This plan is intended to work in conjunction with a major medical plan that you might already have in place. Just so you know, none of these plans are intended to replace anything you already have. They are intended to complement, though they can also work alone. So for the full-time employees, we have a wonderful plan that actually provides some tax savings to the employer and the employee. The nice thing about this plan is it's actually zero net cost to everyone involved. So as an employer, you're not going to be paying for this program. And as the employee, they're not seeing anything out of pocket either. In fact, in the example we're showing here, this employer actually has 150 employees that are qualified for the plan. All 150 that are listed here are participating in the plan. And what the employer sees is on an annual basis, they have $573 per employee that they save in tax savings. So if we multiply that by 150, on an annual basis, this employer is saving $86,000 a year. On a monthly basis, this employer is saving about $7,000 a year. Now, the employee, what they see in their check for their tax savings does vary. But it can be anywhere from 25 cents a month to some see about $2,000. So we average it out over for what we have seen of employee savings on this plan comes out to about $1,500 a year. And that comes out that the average employee is going to be saving about 25,000. If you combine everybody, all 150, it's $25,000. You divide that by 150, you get about, $200 per paycheck that the employee is seeing on their paycheck that is not coming out of the employer's account. It is tax savings that they get to take home and use to support their family and to maybe relax and see a movie now and then. So whatever that happens to be. So the nice thing about this is that it does depend on how many employees that you have, but any employer that qualifies for this plan is going to see some tax savings. Whether you have 25 employees or whether you have 1,000 employees, you can qualify for this plan and you can see those tax savings immediately. They stay in your bank account because they're FICA tax savings. It's not a refund. So to make that clear, what that means is less money comes out of your bank account. You don't have to wait for the IRS to send you a refund. You don't have to fill out paperwork. It's just part of your regular tax filings. You're just sending less of it away to the IRS, and you get to keep more of it into your account. And that means that as a business owner, you have a better cushion for building your business. You have a better cushion for making a website, doing advertisements, fixing up your facade, or hiring another employee. All of those things are available to you because it's your money to do with what you like. The employees are happy because they see more money in their paycheck and they feel like they got a raise. So that's always nice too, not to mention what this plan provides for them in regards to the health savings. So the health savings actually is going to provide them. We'll get to that in a later slide. I'm jumping ahead of myself. So let's get into what the paycheck looks like for the employee. So here we're looking at John Smith. Now, John Smith is a very average employee. Okay, he has not married. He is not putting away anything in his 401k. He is not participating in any health plans, nothing that brings him any Section 129 benefits. He makes $5,000. He pays taxes on $5,000. He takes home the rest. John Smith is a very regular kind of guy. So in this case, we see for $5,000 a month that Mr. John Smith is making, he's paying $515 in federal income tax. He's paying $135 in state income taxes. Then he has his contributions to Medicare. So he's paying $72 to that. And in Social Security, he's paying $310. Now we look at it when Mr. Smith is on the plan here. Now the difference here is that he has a pre-tax withdrawal coming out, a $1,200 claims funding that's going into the thing. That reduces John Smith's taxable income. So Mr. John Smith now is no longer paying his income taxes on $5,000 a month. Instead, he is paying it on $3,800 a month. And that means instead of paying $515 to federal, he's paying $313. Instead of the $135, he's paying $102. Instead of the $72 for Medicare, he's paying $55, and Social Security goes from $310 to $235. Now, this tax savings is already saving Mr. John Smith almost $350. But now John Smith is using the CHAMP plan. He is using this program and he is filling a prescription. He has gone to see the doctor. He has used the telemedicine app, which I will tell you about in a little bit. And even if he didn't do any of that thing, he watched a video that was suggested for him on smoking cessation, on, better exercising habits or better eating habits. He's working to improve himself. Because he did these things, he gets the CHAMP benefit into his plan, which is a non-taxable benefit, and that's for $1,010, And because that is non-taxable, comes in after his taxes have been paid, now Mr. John Smith is seeing an increase in pay. His pay went from $3,966 to $4,102. So he's taking home $135 more a month. This is the basic gist of how this plan works. Now, that $1,200 that comes out of Mr. John Smith's paycheck, that's a set amount. And it's set that way so that we can help these people who make $18,000 or more. If that went up, we would have to maybe change values a little bit, but it's set so that you are always saving the FICA share on $1,200. That's what you get to share in. That's how we get the business savings. And the employee, they get their savings based upon that 1,200 plus any other Section 129 benefits they have. The process for deciding who qualifies, we have to take a look at your entire employee base, and we go through and see which employees see an increase in pay after these changes are made. Now, it's different for every employee because I have my 401k contributions. I have 4 dependents. I have different taxes that are coming out of my check. So my taxes are going to look different from, say, Danielle's taxes. And because of that, I might qualify, or she might qualify, and the other one of us may not. An analysis is done on your employees so you know ahead of time exactly who qualifies, how much their paycheck is going to change, and how this is going to impact your business. Once those numbers are seen and you decide, yes, we want to go ahead, then you can put it to other employees who may not see an increase in pay if they want to pay whatever the difference is in order to be able to also gain the benefits from this plan, which we still have to go into. But ultimately, what you see, you do see a savings per participating employee for the business, which is really, really huge for all of you business owners out there. Now, what does this plan do? What is it doing? Why do they want to sign up for it? Well, the big thing, one, there's no net cost to this. So as I said, unless the employee doesn't qualify and they choose to pay into it, then you're seeing a more of an increase in pay than a decrease in pay. And then you get to go to the doctors with no copay, no deductible. You can see your doctors for anything from I have a sinus infection to I need to get my annual exams taken care of at these no additional costs. You have zero copay on more than 300 different prescriptions and an additional 200 prescriptions at $1. There are no limits to the number of times you can see your doctors. There's no limit to the number of times you can go to urgent care. And you have an amazing telemedicine app. Now, I use this thing all the time, actually. The first time I used it was because, well, I have kids. And my daughter was like, my stomach hurts. I don't want to go to school. And I'm like, oh, really? Why don't we use this amazing app that I have? And there's a thing on there called a symptom checker. Without even having to text a doctor, without even having to actually make an appointment with them, I just went through the symptom checker and put in all of her symptoms. And it said, yeah, sounds like the common cold. And I was like, well, honey, the common cold lasts for 3 weeks. You're going to school. And so she went to school, no more argument. But in other situations, my husband has anxiety and pretty bad anxiety. And one thing that's included on this is mental health services. We are able to use this at no additional cost to immediately speak with a medical provider who immediately connected him with a mental health expert. So, for those people who don't experience or understand what happens with mental health and anxiety issues, what happens is that he becomes very, very sick to his stomach. He overanalyzes everything, panics about the smallest little thing, and is unable to function or move forward to even solve a simple thing like, I don't have the right socks. I have to have black socks and I can only find white socks. Why can't I find black socks? And it will paralyze him. Normally, he is on medication for this. But once we had access to this app, when he felt those first symptoms coming on, he just sent a text saying, I think I'm having an anxiety attack. And within 10 minutes, he was FaceTiming a mental health expert who was able to talk him down and get him through that attack. So he wasn't debilitated for days on end until we could get him into an appointment, until we could get his prescriptions adjusted, until we could get everything moved up. Within 10 minutes, he was speaking to a lady who adjusted his prescriptions right then and there, sent it to a pharmacy, price checked them for us, and found a cheaper pharmacy, which reduced the cost of our prescriptions by additional $10, and was able to get him calm enough to know it was going to be okay. So he didn't miss any work. He didn't have any other problems. And life went on. And it was such a simple matter to be able to have access to this. And your employees get access to this at no additional cost. And you always are talking to somebody who has a medical degree, whether they are a nurse, whether they are a nurse practitioner, whether they are a doctor. You are always speaking to somebody with a medical degree. You are never speaking with a receptionist. And that is so very important to what we do. And the other nice thing is they call you back. They called him up the very next day. Hey, we're just checking in to make sure you're okay, because they care about what you're going through. So there's a number of wonderful, wonderful services just through the app. Everything from, if you pull into the emergency room parking lot, the app will come up saying, I see you're at the hospital. Do you need to talk to us before you go inside? You can be sitting in the ER in the waiting room talking to them. This is what's going on. And they'll send you a list of questions that you want to make sure you ask the doctor about the symptoms you're experiencing. So you have a more effective conversation, a conversation that can avoid unnecessary scans, or can time those scans so that they're not during emergency hours. Maybe it's okay for those scans to be done the next day, when during regular working hours, when they're going to cost half as much. And that saves the business money when they're on your major medical plan, because the major medical plan is going to charge you for every scan and every visit. And if your employee is able to reduce those costs, then the employer is paying less cost as well. And that's another cost savings that you see. So I absolutely love the app. I use it all the time. And the other available services on this, I will say, kind of wish my employer had them. So I just went through a bunch of this, actually. I apologize, but some other things that are included with this app that I've been telling you about. We're also including dental and health and vision services. We are also including a few other ACA preventative services that are to be included as we move along. And we're constantly working to add more and more services to it. But right now, what's included under this plan is this app that I told you about: zero copay visits to your doctor, prescriptions, prescription management, vision, dental, and x-rays. Those are your primary benefits that you have with this one. And then on top of that, like I said at the beginning, we want to make sure not only are they healthy, but they're also financially secure. And part of that is dealing with people's questions regarding their retirement, estate planning, and things like that. Many larger companies already have a benefits plan in place. They have a 401k in place. They have something to help their employees. But some of us smaller companies, they can't afford to have all of these additional benefits. So that's included in this plan. And what it does is provide you an app that connects you to a licensed financial consultant. And that individual can answer any questions your employee has. I had to empty my IRA or my 401k because of COVID situations that came up. How do I start saving again? I want to get life insurance. I want to get a will and trust in place. I want to set something up for my kids' college. Any of these questions, they're going to somebody immediately that they can trust and that builds something that's going to work for them. And that is really, really important. And not only that, they don't pay for that person's services. You have a question, you jump in there, ask the question, and that you get an answer. Hey, I have a debt problem. What can I do about this debt problem that I have? Great. This person is going to help you deal with that debt problem. So this is a second side to support the health side. You also have the wealth side. Now, These are a little bit more pictures of how that health app works. You can see we've kind of tried to break it down into very simple, general ideas so that you can be directed to an individual who specializes in that other area. If you're looking at tracking your cash flow, you want to set a budget, you want to, you know, manage the money coming in, there's something there for that. You have debt problems, you click on the debt management, you get access to somebody there. Proper protection includes in life insurance. It includes making sure that your investments aren't losing money and things of that nature. LSI is for wondering whether or not you're living too long is what you're worried about. You're worried about living too short, or you're worried about getting ill. How do you protect your finances, your family, about those things? Future planning is, of course, retirement, making sure that you have an estate present, things of that nature. Building wealth ties into it a little bit, but it more has to do with how to make your income grow so that you have more available. This can be used for a variety of different things. It's not just necessarily for future, but you might want it for the estate. You might want to be able to pass it on to somebody, or maybe you just really want to build it up for a cruise. Maybe you really want to save enough money to be able to go to Europe for the summer. Whatever that happens to be, this is where you go to figure that out. And then preserving wealth has to do with taxes, because everyone has to pay taxes. Uncle Sam is going to get their cut. So you want to make sure that you are paying your taxes properly, but also make sure that you're investing in a way that saves you money in the end rather than costing you more money. So when it comes to all of these things, we use a lot of what's called CPT codes. CPT codes are the insurance speak for you came to the doctor and did something. You achieved something, you took a step medically and a bill went out somewhere. These CPT codes are used to show that the employee is actually participating in the plan. And they are tracked quite religiously by our system to make sure that we can prove to Uncle Sam, because we all need to make sure we're tight with Uncle Sam, make sure we prove to Uncle Sam that yes, the employee actually did do the requirements they needed to receive that benefit back in their paychecks. And that makes it easier on the employee side and easier on the employer side because it's not your responsibility to worry about it. Our company takes care of everything. We do the education on the plan. We do the putting it in place. We help the employees understand the plan, how to use the plan, how the app works, make sure everything's set up. And ultimately, when your employee has a question, they may come to HR and the HR says, here's a 1-800 number. And somebody will answer the question and help that employee through the process. So your HR doesn't have any additional challenges they have to fix. They don't have something new they have to learn. All they have to do is provide some information up front while we see whether or not you qualify and what you need, and then give the employee the 1-800 number. That's it. Easy for you. They can focus on the tasks you've already assigned them, and your employee still gets the additional benefits and the knowledge to use them. So, in addition to this, we have part-timers that we haven't talked about yet, and we have our 1099. Now, to recap, part-timers are those individuals who make less than $18,000 a year. Okay. And our 1099ers, those are our contractors. They may be here for 3 months. They may be there 6 months. They may be there 6 years. But they're a contract worker. They get taxed and pay everything differently. So they don't qualify under that same full-timer plan that we were talking about before. For these individuals, and I put this slide in the wrong area, I apologize. This is actually showing your coverage for your area for the last plan I was just telling you about. It actually applies to the next plan too. But what this is I searched your zip code 30828 and looked up all providers in our network that would accept our plan within a 30-mile radius of that. And what we got was 393 different hospitals, urgent care centers, specialists in your area that accept this plan. This is supposed to come right before the last slide, but that's what this is showing you here. So a lot of times the question comes up, well, But what about how do I know that this is available in my area? It's a nationwide plan. Well, we use the Health First Network. The Health First Network is the second largest group of medical providers in the country. And so for your area, there are 393 different providers who accept these plans. Now, if you have a provider who does not accept our plan, it is easy for them to get onto it. It's literally a phone call that they make saying, yes, this is what's going on. Yes, we're willing to accept this contract. They sign a paper and boom, your now provider is now accepting this plan as well. Easy as can be. But even then, we were looking through this list, Jeffrey and I, before we scheduled this, and a lot of the providers on there was like, hey, that's my grandmother's doctor. Hey, I use that person there. They are the doctors that you see regularly. So there's no need to change providers that you're already seeing, who already know your history, that you're already comfortable with. That's the reason for that. Now, back to part-timers and 1099ers, since this slide got misplaced. When it comes to those individuals, it's a little bit different for providing care for them because they can't get those tax savings. So for these individuals, there is an additional cost associated with that. So they also included in all of these plans is that app I was telling you about that allows you all of these features that we've already talked about. You're talking to live healthcare providers. They have your profile. Excuse me. They have your profile in order to know, what you're allergic to, what doctors are you seeing, what medications are you taking, and they're working with you to help making sure you have it in. Now, some of the other things that they have on the app that I haven't talked about is they have an insurance tracking database. So if your employee is on your plan, or if they're on a spouse's plan, or if they're on Medicare, they put that information into the app. And so when it comes down to, hey, there's only so much we can do remotely, you need to go and actually see a local provider. The individual they're talking to will pull up their insurance information, pull up their location, and say, there is a provider accepting your insurance, and they are 10 minutes from your house. Now, there's a great story about this, actually. This one didn't happen to me. This happened to another person using the app. The guy had recently had cancer. And I mean, just gone into remission. And it was Christmas. And by Christmas, I mean, it's December 24th. It is 10 p.m. And he started to suffer from the shakes. He started to suffer from a lot of the symptoms that they told him to look for when he was taking the chemo. And so he pulled up the app to talk to them about it. And they're like, okay, you really need to see somebody in person, but it's very rural and it's Christmas Eve at 10 o'clock at night. They found that there was a provider who was within 20 miles of his home, but he had shut down for the night. They called the doctor and said, look, I have this patient. Here's his situation. Is there any way you can see him? They convinced this doctor to go in Christmas Eve night and open his practice to see one patient so that that man didn't have to go to the ER. And that guy was able to see a doctor in person. They got him taken care of, and he was home by Christmas. No big deal. These people care about what you're doing, and they want to make sure you're taken care of and your employees are taken care of. It's absolutely huge. So, also included with these part-timer plans is that financial services I was telling you about. So they get also the access to be able to call it. And again, anytime they're calling this the financial specialist, it is at no additional cost to the employee. So they can ask any questions they have, they can set anything up. And yeah, I'm investing some money. I got to put the money in the investment, but I don't have to pay any additional money to the advisor who's helping me figure out where things need to go. So that helps to make sure that even your 1099ers who don't get access to your simple IRAs, who don't have access to your 401ks, they can actually be investing and saving for their retirement because we care about them too, and we want them taken care of just as much as we care about our full-time W-2 employees. Now, because like I said, these plans do cost money, This is what is included in there. Now we have three different tiers for these type of employees. And it goes from the bronze, the gold, the platinum, starting at $109 all the way up to $249. Now, they include, even at the basic level, the app and prescription management. That is the very, very basics. You can talk to the doctor remotely, but it doesn't cover in-house visits. But if you go to the gold level, now you get in-person visits. And this is the same level as you were seeing with the other one. There's no copays, no deductibles, no limits. They get to go in and see a doctor without having to do the copay for $199 a month. Now, this does only apply to the employee, though the remote, this app applies to the whole family. But the doctor's visits, the dental, the vision, that's for employee only. That's for the individual loan. If you go up to platinum, you get something called supplemental benefits. This is guaranteed life insurance. Now, I have word that we're going to be adding this into gold as well. Gold is going to have guaranteed issue. You don't have to pass a medical. You don't have to worry about those, but it's guaranteed issue $50,000. If it all goes right, right now it's just platinum, and platinum is guaranteed issue $100,000 life insurance. Now, the life insurance that's included with this is, one guaranteed issue. That means that you can be sick, you can be, having other problems, and you can have this issue to you. Normally, you try to get coverage and you can't get it. This is included, and it's included in that price. So it's not like you're paying extra for the life insurance. So that is really, really huge. The cost of it is all included in these plans. So that's really, really big. Another thing that is supposed to be added, it's not on the list yet, but it's supposed to be added, is going to be disability insurance. And that's going to be really, really big. We're still negotiating with some companies. We're still trying to get it so it fits into these price points so that we don't have to bump those prices up, but that is included in these plans. So right now, it's just the guaranteed life insurance, but in the future, we'll let you know if you sign up, if we're going to also be including that disability insurance. And that makes a huge difference, especially when it comes to 1099ers. They don't have a lot of cushion. They don't have sick days. They don't have, the family plans or anything to make sure that they receive income when they get sick. So it's real. These kind of things are huge to making sure that these families are taken care of. And we know as business owners, we care about everyone who's working for us. We care whether they're, working a W-2 job or they're working a 1099 job. You know them, you know their family, you know their struggles. This is one more way, one more resource you can provide to them to help them take care of themselves and their families. And that, I think, is one of the biggest, most important part of being a business owner, is helping to bring the whole community up, starting with your employees. So there's that plan. Now, how do you start? Well, the first thing is to see what plan do you qualify for. So if you have your W-2 workers, then you could qualify for that zero net cost plan. In that case, we start with a census. It's a very, very simple census, but it does include details on what they're paying out of their checks. So if they have parental, forgot the word, but if they're paying for child support, there it is. If they're paying a 401k plan, if there's a health plan they're already paying for, how many deductibles they have. The spreadsheet is laid out very simply, and it's just a copy paste situation. You don't have to give us the employee name. We just need an employee designator. If you have ADP or if you have paychecks handling your payroll, you don't even have to fill out the census. Literally, we work directly with them. We just need an email from you saying, this is my ADP number. I give them permission to access this data for the purpose of this census. That's it. And we can get the information directly from those two companies. They've already vetted the plan and they already have people using the plan on their systems. So that's the easy way to do it. Once you get your proposal back after we have gone through the census that shows you what employees qualify, how much they qualify for, how their paychecks change, and what you are going to save in taxes, then you decide, do I want to do this? Is this right for my business? You get a simple agreement that you sign. There is a month-long enrollment period where we meet with your payroll person, whoever is feeding that information in. We run a payroll just to make sure it all comes out right. We have never had a problem with it being incorrect. And part of it is going through working with your payroll person, making sure the systems are in place. And once everything is set up, this thing just runs itself for the most part. You're required to send us a spreadsheet on a monthly basis that tells us if an employee has been left, if you're adding an employee to the program, or if there are any problems with employees that is going to restrict their access to these programs. You just send that spreadsheet on to our office, and we make sure that it correspondingly reflects the benefits that they're receiving. It's simple as that. It is very, very easy to handle. We do all of the education. Included in that enrollment period is actually a Zoom meeting similar to this that we can do with the employees, where we lay out how the plan works and take any of the questions they have. You're allowed to record that and show it to any new employees that you bring on after that date so that they also are using the program effectively. It's intended to be simple, it's intended to be sweet because you have a lot more things to worry about than how to get something like this running. That's our job. Your job is to make a successful business. Our job is to give you the benefits that make your employees want to stick around. So, oh, well, that is another lady because she gave me this presentation. That is it for this presentation. If you have any questions, you can go through Miss Danielle Russ. She is such a wonderful lady helping to make these available for you. And she can put you in contact with me and we can see about getting that census through.
I do have one question for you. Somebody had texted me. Is there a limit to like the number of employees that you can have?
There's no maximum limit,
Okay.
but on the zero net cost plan, we do have a minimum level of employees.
Okay.
So I recommend a 25 minimum to apply, though that's kind of a fudged number. We have to have at least 15 employees who qualify.
Okay.
And so that's the only way to make it a cost-effective solution so that it pays for itself and, pays everybody else.
Very cool.